Good morning. Welcome back, everyone. Working our way up to 11 minutes before 7. The high school football season is fast approaching. So what should parents look out for when it comes to concussions? They can become more than just a couple of bumps and bruises. Joining us this morning is sports medicine expert Sheldon Wagner. Good morning, Sheldon. Thanks for getting up with us.
Good morning, Amy. Thanks for having me today.
Yeah, it is hard as a parent to wonder if the headache is just the result of getting, knocked on your butt, or if it really is something dangerous like a concussion. How should parents, what should they be looking for when it comes to concussions?
Anytime that there is a loss of consciousness, that's one of the most common things that people are aware of as far as the sign and symptom, but also anytime that there's any amnesia, a loss or difficulty in concentration, headache, dizziness. Those are other common symptoms for concussion that folks should be watching out for. You want to also be able to relate that to some collision or some fall. It doesn't always have to be necessarily involving the head hitting another object, but even just a good body-to-body contact, a big tackle or a mid-air collision on the soccer field could result in a concussion as well.
Now, a lot of these programs, soccer, football, even volleyball, they do have trainers that are standing by watching. But, some of the symptoms you mentioned, lack of concentration, a headache, kind of sounds like a teenager just having a rough day as well. Will they be worse than is it a worse headache? Is there worse confusion than maybe just being overtired?
Well, again, you have to relate it back to an injury or a big collision. And so you're right, though, that those are some symptoms that some teenagers could report every single day. But parents and athletic trainers and coaches have to be very vigilant as far as watching for collisions to kind of pique their degree of suspicion, and then we want to follow up on each of those instances.
So it's smart for parents every afternoon, evening at the dinner table to start the conversation by saying, hey, how did practice go today?
Absolutely. That's a great way to connect with your kids, and then also just to make sure that they're acting their normal selves and acting appropriately.
Okay. And what should you do if you think your child has a concussion?
You want to have them evaluated by a medical professional. If there is an athletic trainer available at the high school, that's a great option to start with. Otherwise, a family physician or the emergency room is an option if you're worried about that person's status immediately. So if there's any situation where the athlete is having a deteriorating condition where maybe their headache is getting worse as time goes on and not better, if they feel like they're just really not with it, or you have repeated nausea, vomiting, those types of things require immediate attention.
All right. Well, Sheldon, thank you so much for joining us this morning, and we hope that all the high school athletes out there can stay injury-free this fall. Wouldn't that be nice?
That would be great. Thank you very much.
Thank you so much.